It's great to have back on the program today Vincent Racaniello, who's a virology professor at Columbia University and also host of This Week in Virology. Great to have you back. I really appreciate it.
Oh, great to be here.
So, I guess we have to start with Omicron and if whatever prediction you want on Omicron, you can find it, which is this is the beginning of something that's going to get much worse. This is the beginning of the end of the pandemic and everything in between. What do we know now about the level of transmissibility of Omicron in terms of its R value, as well as how much more or less likely it is to cause hospitalization?
So determining transmissibility is very difficult. So getting a R value, especially this far into an epidemic, is very hard. But I like to look at what we call secondary attack rates, which are calculated in closed situation like a household,
Yes.
where you can know that this person was infected and then within a certain amount of time, these other people got infected. And it's not easy to do that. But recently a preprint came out of Denmark where they did it. And the beauty of the study was it was just when they were transitioning from Delta to Omicron. So you had households that were either an Omicron household or a Delta household. It was
Right.
perfect. And they had good numbers and they have a terrific medical records registry there so they could get all the information. And what was very clear is that Omicron has a higher secondary attack rate than Delta, so it's transmitting better in the household situation. But that appears to be entirely due to the fact that Omicron is evading antibodies, because as you know, it has many changes in the spike protein, more than any other variant. And if you take sera from people who have been vaccinated or recovered from infection, it doesn't block infection with Omicron as well as, say, with Delta. And so the Danish scientists concluded that this increased ability of Omicron to transmit, say, within households is entirely due to immune evasion and not to an inherent increased transmissibility of the virus. So we imagine that there are some properties of viruses that can make them transmit better. Maybe they reproduce better. They're more stable in droplets that come out of your respiratory tract. But that's not the case with Omicron. It really is evading antibodies, and that's why it's spreading. Now, the other part of your question, how about disease, right? Now, with first reports out of South Africa suggested it might be milder, and people started to call it an Omi-cold, which is not really right. My
Yes.
colleague, Daniel Griffin, an infectious disease doctor, says that's not right because he's seen plenty of very sick people infected with Omicron, and especially unvaccinated people. So in the unvaccinated, Omicron can be just as severe as Delta and previous variants. But the South African study was kind of complicated because a lot of the people in their study were vaccinated, and a lot of them were younger, and a lot of them didn't have comorbidities. And so that all biases it to be milder. So, making conclusions very quickly about how severe infections are is very difficult. So I would say at this point, we know that Omicron can evade immunity, and that's why it moves through a population well. It can infect vaccinated people, just like Delta could. But in a vaccinated person, the disease is much milder than in an unvaccinated person.
There's so many things that we could go off to from there. Just a couple. So if we look at the UK as an example, a layperson might look at cases and deaths. And of course, at this point, we know that not nearly all of the infections are being captured as a case, which depends on a test. But putting that aside for a moment, it looked like during the Omicron wave, cases went up about 6x in the UK, known cases, whereas deaths went up somewhere between 80 and 100% or so. When you see that, it suggests that it is in some way less likely to kill people, and that's UK, not South Africa. But are those two numbers alone not enough to really tell us that?
Well, the problem is that a lot of the people are vaccinated, and in that, if you stratify the data,
Yes.
vaccinated versus unvaccinated, make sure you control for age and comorbidities, which is not easy to do.
True.
Then you find that it's milder in vaccinated people, but so is Delta, and so are all the other variants. But the fact is that vaccination works. It prevents you from getting severe disease. And now part of the issue is with Omicron, it came at about the holiday season, right? When everyone is traveling and getting together. Plus, we are now getting together way more than we ever did since the beginning of the pandemic because people are starting to relax. And all of this contributes. So, movement of a virus has many factors around it, not just the virus, not just your immunity, but how people behave as well.
The wastewater data in some cities in the United States is showing just dramatic reductions in the amount of virus during this Omicron wave. I think when I looked 10 days ago or so, or maybe a week ago at Boston wastewater data, it was down about 2/3, even though cases are only down about 10%, which you would imagine that would be cases would be a lagging indicator to the wastewater. How important is the wastewater data?
I'm not sure you can quantify anything. All you
Mm.
can say is we have this virus here now. So there may be a period where you don't see a virus in wastewater or the levels are very low, and then suddenly you get more positives. So that can inform you of an impending epidemic. But I would not make much of the levels because this is incidental virus that you're swallowing. It's passing out of your gastrointestinal tract and going into the sewers. So it's not really part of the infection process.
Mm.
So to ascribe any meaning to how much is there, remember we're doing PCR to measure viral RNA in the water. And as a recent study out of Switzerland just showed, there is very little correlation between PCR levels and infectious virus. So I think you have to realize the limitations of looking at virus RNA in wastewater.
That's fair. That's fair. Last time you were on, we talked a little bit about the very top level understanding that we have about viruses over time becoming less deadly. And you gave us many caveats when we talked about that, but it was this sort of general idea. In the last few weeks, as the conversation about what happens after Omicron has become a more and more relevant conversation, there have been a bunch of different articles coming out claiming to debunk that idea as a general principle, that really viruses become more chaotic and that could get you milder disease, but it might not, and that there are counterexamples from history. Can we now, because it seems more relevant than ever, talk a little more specifically about this idea of what is likely to come next after Omicron?
So the idea, which we talked about last time, it's a human idea that viruses over time tend to get less virulent. But we're talking about long periods of time. We're not talking about 2 years here.
Ah,
So for example, if a virus spilled, and remember, all human viruses came from some other animal at some point in time. Let's say thousands of years ago, tens of thousands of years ago. Measles virus, 15,000 years ago, spilled over into people from cows, right? And so initially, it's probably quite lethal because it's a new host. We have no immunity to the virus, and it does what SARS-CoV-2 does. But over time, population immunity grows, and that helps you have a milder disease when you get infected. Now, there's also this hypothesis that maybe the virus changes over time because there's no point in killing your host or making your host very sick. So random changes in the genome that reduce virulence may persist. But I have to say, with the one exception that we might have talked about last time, using viruses to kill rabbits in Australia, there's no other evidence that viruses tend to get less virulent over time in their hosts. It's just an appealing hypothesis. So the Australian situation, they had brought in rabbits in the 1800s for hunting purposes. They multiplied like crazy. There were too many of them. So they introduced a virus to try and kill them. And in the first year, 99% of the rabbits were killed. But then those 1% that survived were more resistant to the virus, and then the virus changed to be less virulent as well. So it's actually a beautiful experiment that's consistent with this idea. But I must say there's no other evidence for it. And as you mentioned, as soon as Omicron came out, we had these data from South Africa. People were saying, oh, it's getting less virulent. But I think it's far too premature to say that because, as we've already talked about, there are lots of confounding factors there.
so what does that do for the conversation about what is next and whether we are months from shifting from the pandemic to the endemic phase of this? Is it can we really say anything about that at this point?
Well, from the start, we have thought that as population immunity grew to this virus, we would have less and less severe disease. And we see that in vaccinated people. It supports that. Even though we have many variants emerging that can evade immunity to a certain extent, the vaccines still work. They protect you from severe disease and hospitalization really in the 90% still. So, and we know from other coronaviruses, the common cold coronaviruses that infect all of us every year, that widespread population immunity probably associates with milder disease. And so that, from the very start, led to this idea that over time, as more of the world became immune to SARS-CoV-2, we would have less and less severe disease. The virus would not necessarily be changing with respect to virulence, but simply population immunity would do that. I really think that's what's going to happen, because we see the vaccines working really well despite the antigenic evolution of the virus. So I've always thought, and this was actually an idea influenced by Ralph Baric, who was a coronavirologist for many years. He said, this will probably be a common cold coronavirus. Who knows how long it will take? And at that point, we might not need to vaccinate it against it any longer.
We're not at that point yet, though.
I don't think we are, because, most of the world is still not fully vaccinated, right? There are some countries that have very high rates of vaccination, and they have much less disease as a consequence. But there are other countries like Africa, which are barely vaccinated. So we can't hope to end a pandemic until we get either a lot of people infected or vaccinated. I mean, that's what's going to happen now over the next few years. You're going to either get vaccinated or you're going to get infected. And in both cases, you're going to get some kind of immunity.
There are a few countries, at least a couple, the UK, Australia, that are pretty quickly going in a direction of saying, we believe we are functioning as though we are in the endemic phase. Mm-hmm. We are going to start removing restrictions and kind of putting this at the individual level to say, if I have a particular reason that I need to go beyond what's required of me by the state, I'm going to do it based on my level of risk. Does that make any sense to you at this point in time?
It does. And I've been thinking about this for now many weeks, because it's very clear we have multiple vaccines that work. They don't prevent infection, which is normal, but they do prevent severe disease. And so in many countries like the UK and Israel and the US, where we have plenty of vaccine, we now have vaccines that can control severe disease. People who have decided not to be vaccinated have made their choice. So I think the rest of the population can now start to move on. The only problem with that idea is that if too many unvaccinated people get infected, as you know, the healthcare system gets overburdened.
Yes.
And that is a problem, because they have other issues to deal with. They have other health problems and patients to deal with. So we don't want hospitals full of unvaccinated, severely ill COVID patients. That's why I think in many places in the US, we're still masking. Even though we're all fully vaccinated, many of us are fully vaccinated, there's no risk to us anymore of getting severely ill. We are protecting the unvaccinated.
The biggest and most regular pushback that I hear when anybody says what you just said is, but hold on a second, even the people doing everything correctly, getting their 3 doses and et cetera, they are still at greater risk due to the unvaccinated because of the ability to spread the disease. The counter that's increasingly being placed upon us is, well, hold on a second. With Omicron, it's not clear that the vaccines prevent transmission. They prevent death. They prevent serious illness. But do they really prevent transmission? So it's really a two-part question. What about the people saying, even those who did the right things, we are still at risk because of everybody else? And number 2, what do we know about the effect of the vaccine on transmission right now?
So I feel I am not at risk from an unvaccinated person.
Okay.
Because I'm triple vaccinated. And if I get infected, which I likely will, I will have a mild disease, right? There's a very good chance I have a mild disease. Most of the severe disease in vaccinated people, that 10% or so that don't, are in people with comorbidities. Either they're older or they're obese. That's a big one, or diabetic or asthmatic. those are the people who are most likely to have severe disease, even if fully vaccinated. Of course, we don't want to forget the kids under 5 who can't be vaccinated yet. We still have to be careful about them. So I don't view vaccinated people as the ones at risk. It's the unvaccinated people, and they're the ones that are going to cause problems in the healthcare system. Now, with respect to transmission, there was a wonderful preprint out of Switzerland last week, and this complements other work that's come out as well, which clearly shows that, well, first of all, you can't measure transmission by doing PCR. That is very clear. And almost every study that has looked at shedding of a vaccinated person is wrong because they're measuring PCR, and that does not correlate with infectious virus shedding. In the Swiss study, they showed that a vaccinated person not only sheds less infectious virus than an unvaccinated person, but does so for fewer days after being infected.
Okay.
And so that has significant implications. So vaccination doesn't abolish shedding. It doesn't abolish transmission, but it knocks it so far down that it no longer plays a role in driving the epidemic. That's how I see it.
That seems to then support those who say, I'm vaccinated, but the unvaccinated are putting me at risk. I know statistically you still won't be seriously ill, but a lot of people have comorbidities in this country. It sounds like it's not wrong to say, even as a vaccinated person, the unvaccinated do put me at greater risk.
No, the unvaccinated do not, because you are not going to get sick, right? If you're fully vaccinated, the likelihood you're going to get severely ill is very low.
Oh, I see. So it's both.
Right?
It's both that by being unvaccinated, you are shedding more virus, but
yes.
by being vaccinated, you also are less likely to actually get sick.
Exactly.
Okay,
and you are less likely to pass it on to someone else as well. So the more people we have vaccinated, the more likely we can stop the transmission.
We are going to link to that preprint from Switzerland. It sounds like there's really a wealth of data there. We've been speaking with Vincent Racaniello, virology professor at Columbia University, and make sure to check out This Week in Virology. Always great having you on.
Thank you for having me, David. Appreciate it.